And now policymakers are being advised to assess how COVID-19 is expected to disproportionately affect women and girls. Gender inequality can come into even starker focus in the context of health emergencies. A senior fellow at the Center for Global Development, David Evans, spoke to Wendy Laryea.
With COVID-19 continuing to spread, questions have arisen on what has been realized so far and what should be expected in terms of impact on women and girls.
Emergencies heighten all kinds of inequalities. Policy decisions are often made quickly, and if women aren't part of those decisions, their needs are less likely to be met. Health emergencies also mean more people need to receive care in the household, and women usually provide most of that care.
The Center for Global Development explains, beyond direct effects, most of the other impacts affect women negatively and disproportionately. The center noted, as the pandemic spreads, the toll on women health workers will likely be significant.
In Africa, 2/3 of all nurses are women. In many areas, they're the ones running the health centers. That puts them right in the path of the virus, and we should recognize the sacrifice they're making and make sure they have protective gear and appropriate training to stay safe and continue to offer life-saving services.
School closures are likely to have a differential impact on women, who, in many societies, take principal responsibility for children, while women's participation in work outside the home is likely to fall. When women have less decision-making power than men, either in households or in government, then women's needs during an epidemic are less likely to be met. According to the Center for Global Development, health crises can trigger economic crisis. Economic crises affect women disproportionately, particularly in low-income countries.
In the short term, governments can scale up programs that provide income to the most vulnerable households. That way women don't have to choose between caring for their loved one's health and keeping food on the table. In the medium term, we can work towards better gender equality in household duties so that women and men share the responsibilities of care for children and sick family members.
The center adds that the impact of this pandemic will be felt for many years, as women are often disproportionately affected by the follow-on effects of the disease. A first step in doing that is making sure that women are a central part of the teams designing those responses. Wendy Laryea, TV3 News.